Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then the next important thing is the gastric ulcer. You do an barium meal. For diagnosis of gastric ulcer, for diagnosis of gastric ulcer, we do a barium meal. And in the barium meal, what do we see? So here there is an ulcer seen in the stomach. So here in the gastric ulcer is seen. So this gastric ulcer will show niche is seen on the lesser curvature and notch is seen on the greater curvature. That is, within the lesser curvature you see the ulcer, because ulcer is more common in the incisura angularis in the lesser curvature. Here you will see an ulcer and notch like this. A notch is seen on the greater curvature in the barium meal. And then, how is the ulcer seen? The ulcer has a regular margin or round margin. It has a regular and round margin is present for the ulcer, followed by a spoke wheel pattern is seen inside. There is a spoke wheel pattern is seen like this. It is seen inside, and you will also see that there is overhanging mucosa of margins are also seen towards the ulcer, which are called as Hampton's lines. So at the margin of the benign gastric ulcers, you will see that towards the ulcer there is overhanging mucosa will be seen towards the ulcers, which are called as Hampton's lines. Something like this. The ulcer folds will be seen like this, which are converging towards the ulcers. There is overhanging mucosal folds are seen, which are occurring towards the ulcers, and these mucosal folds will converge towards the base of the ulcers. So these all mucosal folds will start converging towards the base of the ulcers. So this is what we see in the barium swallow of a gastric ulcer.
thank you and thank you for watching.